In Miami, Vicky Borken has a devastating condition. Her leg and foot started to grow abnormally when she was 2 years old. Now the growth weighs a massive 39 kilos.
Nobody told me that I was going to get to this size. It just slowly got bigger.
She fears the condition is genetic and that it will also affect her daughter, Breezy.
I love you so much. You love Mom?
Yes.
This area here is extremely tender.
Her leg is continuing to balloon at an astonishing rate, and it needs to stop.
It is life-threatening. It is life-threatening because she's going to have an infection that's not going to be treatable.
Vicky suffers from a rare extreme case of lymphedma, an abnormal swelling of the tissues. Her leg, untreated, has swollen to 102 centimeters and weighs 39 kilos. This is one of the largest leg lymphedemas in America.
I'm looking for some kind of spray because it's going to be a... You guys really can't smell it now, but there's a bacteria in there.
She takes a cocktail of medication, including painkillers, which causes her to slow her speech sometimes.
Apparently some kind of bacteria got in here, so I've been on antibiotics. Bacteria like sees my leg and says, "Oh, hey, let's party." My leg gets this awful smell to it. You're probably getting a whiff of it now. I mean, I can smell it like everywhere. Other people can definitely smell it. Time for the shower.
It's a tight squeeze for her leg, but Vicky can just about manage to drive her automatic.
There isn't a lot of leg room. Right now my leg is down because I just got up. But as the day goes, it'll get where it's this close to the dash. But as you see, this won't even cover one side. I think I've missed out a lot on what I can wear, you know, and what I can't wear, and how good I could have looked in my 30s. You know, strutting around jeans and looking good and everything, but nobody ever prepared me for this. Nobody prepared me for having, like, this gargantuan leg. I can't even get the tip of the shoe on my foot. And these are wide width.
Okay, now...
So that upsets me because it's hard for me to even get sandals.
That foot's a little bit chubby.
I know, but it's still, I can't get into them, Breezy. See, these won't even fit today because of my foot. But this is like the only thing I can get that I can wear. You know, I can walk around in them. But right now, because my toes are swollen, they won't close right. But I don't get to look for pretty ones. I don't get to look for nice ones. I don't get to look for ones that zip up or boots or any of that. Men's shoes, size 11. That's what I get.
Vicky's leg has been gradually growing since she was a child. She was a very active teenager and lived a normal life despite her leg swelling as she got older. Vicky and her mother are convinced her condition was triggered by a dresser falling on her foot when she was 2.
One day I heard a big noise and I came in and your little baby shift girl dresser was on top of you. You didn't seem to be hurt too much, but, you know, maybe a week or so later, I just couldn't put your shoe on. And I noticed that there was a swelling. I think something happened when the dresser fell on you. It brought it on somehow. In my wildest dreams, I never thought it would get like it is now. And I prayed for 46 years that we could do something about it.
Nice meeting you.
Joe Zuther, a lymphedema specialist, is going to examine Vicky's leg to assess what type of lymphedema she has.
Oh my God, good.
Yeah, yeah. You are very mobile. So what you have is called a primary lymphedema. Primary lymphedema results or is caused by a developmental abnormality of the lymphatic system, like a malformation. Primary lymphedema usually develops during puberty or as a result of injuries, like even minor traumas, strains.
Is my daughter at risk for that?
Lymphedema is hereditary. I also want to ask you if large legs run in your family. Yeah. Did your mother, your grandmother ever complain about big legs?
There were aunts, like, way back that had large legs.
It is congenital. It could be hereditary, but not necessarily.
But my daughter's 8 years old right now.
Yeah.
Joe confirms Vicky's worst fears. that her daughter Breezy could inherit lymphedema, and there's a chance her leg could grow as large as her mother's. She tries to digest the news.
Lymphedema is a progressive condition, and if it's not treated properly, it will get worse and worse and worse. Now, if treatment is not initiated...
Vicky's own leg began to swell as a child, when she was 2 years old.
That means it becomes harder.
She's also learned that she suffers from primary lymphedema, the result of a hereditary condition, where the lymphatic system is faulty. The lymphatic system is an invisible network that helps the body regulate fluid and fight infection. It drains excess fluid from tissues and returns it back into the circulation. Vicky's system is not working properly. The fluid cannot flow normally and therefore accumulates under the skin, causing the area to swell.
When the lymphatic system does not work, everything accumulates. So it's like a swamp. There's like no movement. All those water proteins, tissue proteins, cell debris, and tissue becomes very hardened. So it's horrible. That's why, you know, lymphedema needs to be treated.
Vicky's leg has swollen to such an extent with stagnant fluid that the skin has ruptured due to shear pressure, forming bubbles. This kind of uncontrolled lymphedema can result in infection that can spread throughout the whole body. It could poison her blood and be fatal.
I can tell you, your leg can still be reduced down to a normal or near normal size. It just takes a little longer. It's not impossible at all to remove or to bring your swelling down to a normal or near normal size. We don't stick any needles in you.
Therapy would involve a combination of manual lymphatic drainage, a form of massage, and compression bandaging.
We had some problems.
You need to be committed, and you need to wear your compression stockings, you need to do your decongestive exercise, proper skin care, and just stay with the program. Yeah.
Good to meet you.
Pam Cohen and her assistant Debbie will start Vicky's daily course of 2-hour decongestive therapy later this morning.
We can get you up on the TV.
This is going to be a very familiar place, a familiar place to me.
But first, they want to examine the leg and see if Vicky's most recent infection will affect the planned treatment.
I've started getting more of the...
Papillomas up over.
Yeah.
It's the pressure of all of that lymph fluid. We have some work to do, right? But we just want to make sure that you have the infection controlled.
The toes have been like this like since I've been a kid. They've gotten worse recently, but...
Right, you have the fungus growing on your toes. This all starts to grow because the skin is not getting the oxygen that it needs. We're going to work on getting that all down. What I want to do is to measure.
Vicky's condition is the most extreme that they have ever seen.
See, it's 42.5 inches.
It says around 40.
Okay.
The medical team prepares Vicky for a form of massage called manual lymphatic drainage. During Vicky's treatment, the therapist gently strokes the skin in the direction of the lymph flow, stimulating the lymphatic system and drawing excess fluid away from the swollen area, so that it can drain normally. The lymph nodes act as filters, and by massaging these, the fluid is encouraged to move. Therapist Pam Cohen begins the treatment at the neck and will then move downwards to the armpits, the waist, and finally the leg.
We're decongesting, we're opening up. So that's why we have to start at the neck.
Combined decongestive therapy aims to reduce the swelling of the affected limb.
I got it.
The next stage is going to be difficult to endure.
Get you to move just like you did before.
Here, taut bandages encourage the reduction of swelling. As Vicky's leg is so big, putting on any pressure will be extremely painful.
Okay, and I'll pull this out. What we want to do is create a cylinder. If I have a cylinder, if I have something that's even, then I'm going to be able to put even pressure throughout. I want the same amount of pressure here as here, so I'm going to be building up your foot a lot.
I was just hammered down. I can't do anything with it. Ow, ow, ow. I don't think I can take much more.
We're almost done. So we're giving gradient of pressure back upwards, so we're working against gravity, and we're preventing that fluid from refilling.
Is that comfortable?
Once you start to see the improvement, that will give you the incentive to continue, right?
Please don't do that again.
Actually, I want to come up.
This is going to kill her.
Miami therapist Josette Mullins gave Vicky free treatment 7 years ago.
She did well. She actually went down by 10 to 11 centimeters. And then we were going to work on the other leg. However, due to some personal issues, we had to stop. If you've had that for a long period of time, then it becomes part of your life. It becomes who you are. It becomes what you are. Sometimes, at least with the patients that I have seen, some of them are, their deformities define who they are.
Do you know where there's some tape offhand?
For now, Vicky is determined to try to see her treatment through, to show her daughter Breezy that, even if it is hereditary, it can be treated. Over 6 weeks, Vicky's leg has decreased in size dramatically. Although she still has a long way to go, she's lost an extraordinary 10 litres of lymphatic fluid and 38 centimetres around her leg. The circumference has shrunk from 107 to 68 centimetres.
It's been a while since I've seen my foot.
All of this is just so much more pliable. You want to see the lessening of that hard fibrosis. We can actually see her foot. You see that? You can see her ankle. It's really something.
The fact that it here, had the flexibility to go back in is like so amazing.
Vicky knows that it's been 10-15 years since she saw her leg in this position, and we were able to take 10-15 years away in 6 weeks.
Watch out for the spot!
I am.
Those are the ones.
Just watch the bandage.
The next stage of treatment is crucial. To stop Vicky's leg from filling up with fluid again, she'll have to wear compression garments every day for the rest of her life.
Right on.
All right.
Thank you so much, guys. You guys are great. I will think of you every day for the rest of my life. I will. I mean it. I really do. Hi, Breezy. Hi. Look.
Pretty.
Pretty? What do you think?
Pretty nice.
Yeah, look how small my leg is.
Wow.
You know something? I don't need this. I don't need to use this all the time anymore.
The next few months will be crucial to see if Vicky has the willpower and the strength to persevere with the painful compression bandaging. If she does, her leg might even return to a normal size.